So the big question is, how can you dissolve those little crystals of calcium carbonate in the inner ear to get rid of vertigo? That is a topic for today, and I'm going to explain this without using any medical technical terms to make it really simple. The big problem with vertigo is, yes, you're going to feel like you're spinning, but you can also have this nauseous feeling sick, so it can be very devastating. And a lot of people have this condition and they go to the doctor and they might do surgery, they might do exercises, which are great. But then the question is, how do you get rid of these crystals so they don't come back? And mainly what's causing this vertigo in most cases is this little calcium crystal in the wrong part of the ear. They're floating around and they're going to interrupt the communication between the hairs, the nerves that go into the ear, into your brain. And this is going to affect your balance, your ability to feel like you're stable in space. And so what is going on here? It is totally normal to have these crystals in the ear, but they should normally exist in another part of the ear. And this is what I want to explain. So in this first compartment of the inner ear, you have these calcium crystals on top of a membrane, which is basically a layer of gel. And under that, you have these little tiny hairs that are then connected to nerves that go to your brain. And so what is the purpose of these little weights? They're like little paperweights. Well, the purpose is to add mass to the gel. And by adding mass or weight to this gel, you're going to get more sensitivity to the hairs. And that sensitivity is going to relate to gravity in position of the hairs. And so your body has perfectly designed this interesting structure where you have this kind of gel with a kind of a paperweight on top to allow a mechanism to easily know where you are in space. And you have roughly about 1,000 of these crystals per ear. But what's not normal is when they kind of get dislodged and go further down the canal into another part of the ear where they're going to create problems. So these calcium crystals are floating through this lymph fluid. And in a normal, healthy person, that lymph has a very low concentration of calcium. And normally, you should be able to reabsorb that calcium within 20 hours. However, there are reasons why this calcium might not dissolve very fast. And that's what I want to talk about now. Now, number one, you could have head trauma that can jar some of these little paperweights into the wrong part of the ear. You can have an infection that does it. There are also certain medications that can also cause this problem. And then you have age. Just getting older can cause this problem. Because as you age, you start losing these calcium crystals and end up in the middle ear. However, I found some additional information that will pretty much solve every single one of these conditions. Now, they've done testing on this and they found some interesting correlations between people that have vertigo. Those people have higher concentrations of calcium in the lymph. So if you have higher concentrations, you're not going to dissolve it nearly as fast, if at all. And there's some additional associations that I want to mention. One big one is this higher association between people with osteoporosis and vertigo. Now, what is up with that? Well, we have one topic, calcium. When people have osteoporosis, they have a lot of buildup in calcium in the soft tissues. And people with vertigo also have a higher concentration of calcium in the lymph. So what is the key nutrient that you need to take to reestablish this calcium? That nutrient is vitamin D. Think about what vitamin D does in your small intestine. It helps you absorb calcium by a factor of 20x. And then I also found that people that have vertigo have a tendency to have low vitamin D levels. In fact, most of the population has low vitamin D levels, especially as we age. So this is what I'm going to recommend. Minimally 10,000 IUs, but I would recommend 20,000 IUs of vitamin D for this problem. Now, I would also recommend always taking vitamin K2 with vitamin D3, but also I highly recommend making sure you always take vitamin D with magnesium, because vitamin D won't work without magnesium. And magnesium also naturally counters calcium buildup. But in the meantime, you probably need to do these exercises to push the calcium from the canals into another part of the ear to prevent your vertigo. And for that information, watch this video right here. Today, we're going to talk about how to figure out if you have this very specific type of vertigo, and what to do about it. And it's called benign paroxysmal positional vertigo. This is the type of vertigo that will make you feel like you're spinning, okay, when you're not spinning. So the word benign means not dangerous. The word paroxysmal means a sudden increase of a symptom. And the word positional means something related to motion of your head. And vertical means feeling like you're spinning when you're not really spinning. So in this video, we're just going to name it BPPV. And this is the #1 cause of dizziness. And what's normally causing this condition is a calcium crystal that is broken off, and it's in the canals of the inner ear, the ones that are controlling equilibrium and keeping things balanced. So this little piece of calcium crystal is kind of floating in there, and it's interfering with the little hairs. And it's giving you this sensation that is not correct. It's like you're moving when you're not moving, or you're spinning when there's no spinning going on. So later in this video, I want to talk about why this calcium is there in the first place and how to get rid of it. But first, let's talk about how to figure out if you have this condition and what side it's coming from. Is the problem on the left side or the problem on the right side? So in this first test to determine if you have it and what side it is, this is called the Dix-Hallpike test. But you're going to basically do this maybe on your bed or a table with a pillow, okay? And you're going to quickly lower your body in a supine position. So you're laying face up, and you're going to have a pillow underneath your upper back so your head can tilt back, because you want your head extended like 30 degrees backwards over the horizontal. So you want this pillow underneath your shoulders. So the first thing you're going to do is you're going to turn your head to the right about 45 degrees, okay? Now, if you truly have this BPPV, you will experience not just dizziness, but you will experience nystagmus. Now, that's a condition where your eyes can move back and forth horizontal, vertical, or they can rotate. But if you have nystagmus as well as dizziness, chances are you have this condition. Now, this does help to have someone observing you to tell you if that's happening. But maybe if there's no one around, maybe you have a mirror and you're looking at your eyes. But just realize too, before you do any of these tests, check with your doctor, make sure you don't have some type of cervical spine problem where you can't rotate your neck very much. So that's my disclaimer. Okay, so once you've done this to the right side, then you'll repeat this exact same procedure looking to the left side. And so you're usually going to find one side that's going to be involved. So let's pretend the problem is on going to the right side, okay? Then we're going to do the next part, and this is more of a treatment. So what we want to do is we want to create different motions to slowly move this little calcium crystal out of this canal. Okay, that's the goal of this procedure. And it's called the Epley Maneuver. And you would do it on whatever side that you have this problem with. Okay, so we're pretending it's the right side. So first thing you're going to do, okay, is you're going to turn the head to the affected side. So we're going to turn it to the right side, okay, about 45 degrees, and extend it about 30 degrees. And you're going to hold this position for about 1 minute. Now, chances are you are going to experience symptoms when you're doing this, okay? So after a minute of holding this position, now you're going to turn your head to the opposite side, about 45 degrees, and hold that position for 1 minute. Now, what you're doing is you're slowly dislodging this calcium crystal through this canal with the intention of pushing it out to the other end, okay? Now what you're going to do is you're going to roll on the shoulder and maintain your chin tucked down to your shoulder. And so you're going to be looking downward at a 45-degree angle. And you're going to hold this for about 30 seconds. Again, the reason why we're doing this is to allow this little calcium crystal to keep moving through the canal. And the last thing you're going to do is you're going to sit up with your head kept rotated, with your chin tucked toward the shoulder, and then you're going to slowly rotate your head back to normal. Now, hopefully this calcium crystal has moved out of this little canal and you feel much better. This particular treatment should only be done once a day, and you're going to keep doing it until your symptoms resolve. Okay, so what's really behind these calcium crystals building up? That's the next topic. In a 2020 systematic review and meta-analysis, They found some really interesting association between BPPV and a vitamin D deficiency. In this review, those people that had that condition were twice as deficient in vitamin D as the rest of the group. You see, vitamin D helps in the absorption of calcium, and this calcium is dislodged in the lymphatic little tubes in the inner ear. So obviously it didn't get absorbed. So we have a more concentrated calcium in that area. And chances are this is due to a vitamin D deficiency. Vitamin D also helps in the transportation of calcium as well. In another study, I found there was a 5.5 times more likely risk of developing BPPV. And yet another study, I found that BPPV was substantially decreased if the person took more vitamin D. Now, in another study, I found BPPV was 23 times more likely to occur if someone was deficient in vitamin D. 23 times. That's crazy. So apparently vitamin D is the answer for this condition. I will say there were some studies that did not show that this condition had any problem with vitamin D deficiency in the blood. And honestly, I think the reason for that is this. There is a genetic component to this problem. Many people have a problem with the vitamin D receptor. Now, a person could have a situation where they have normal vitamin D in the blood, but not in the tissues because the receptor is downgraded because of some genetic mutation. Just because someone has a normal vitamin D level in their blood doesn't always tell you the whole picture. I mean, this also relates to other things like insulin resistance. When some people have insulin resistance, they might have high insulin in the blood, yet very low insulin in the cells. This is why many symptoms of even diabetes are related to a deficiency in insulin, even though they have this massive amount of insulin in the blood. I mean, the same thing goes with cortisol, the stress hormone too. A person can have this high level of cortisol in the blood, yet have all the symptoms of a cortisol deficiency, right? I mean, cortisol is supposed to get rid of inflammation. Why would they end up with this huge amount of inflammation when they have high amounts in the blood? Well, now you know. The problem is in the receptor. So the same thing with vitamin D. You can't always go with what's going on in the blood. So what am I recommending as a solution? I'm recommending you do vitamin D, and I'm also going to recommend you add vitamin K2 because vitamin K2 is also involved in transporting calcium out of soft tissues. So this is what I would do. Instead of taking a daily dose of vitamin D3 and K2, I would do this. I would take 5 days of that dosage and take it all at once because both of these vitamins, vitamin K2 and vitamin D, are fat soluble. So they'll get absorbed in the body and they'll get slowly released when your body needs it. But there's some interesting data that shows that if you do sometimes take your vitamin D erratically or not every day consistently, there's a little bit better results. So what does this mean? Well, you would take 50,000 IUs of vitamin D3. So if you find vitamin D tablets in 10,000 IUs, just take 5 of those, okay? Hopefully you'll also find one that has the K2 in the right ratio. In the right ratio meaning for every 10,000 IUs of D3, you want 100 micrograms of K2. So in this situation, you would take 50,000 IUs of vitamin D3 and 500 micrograms of K2. And basically, you just take this dose once a week. Now, just because vitamin D is so important, I created another video to show you all of the reasons why you might be deficient and what to do to overcome that. And I put that video up right here. Check it out.